What comes to your mind when you hear the word depression? Stress, suicide, loss of a loved one, marriages? 3 aspects I would like to cover on depression. First, the causes as well as symptoms for depression. Second, who is highly at risk for depression. And last, the treatment and medication a person can receive to help cure depression. Let's start off talking about the cause and symptoms of depression. Depression can interfere with frequently problems from inside or outside of the house. It changes how you think and feel. It affects your social behavior. Depression is a whole body illness. It involves your body, mood, as well as your thoughts. A history of a family of depression, such as alcohol abuse or suicide, can cause depression. Depression in family members increases the risk of depression in other family members. Being depressed as a child increases the risk for depression during adulthood. A serious loss from someone you love, as a close friend, your mother, your father, can also cause depression, as well as chronic illnesses, relationship problems, work stress, family situations, as well as financial situations. Any unwelcome life changes can trigger depression. Now that you're aware of some symptoms and causes of depression, let's look at who is highly at risk for depression. In one study, 21 patients who visit a family doctor, only 1% describe their problem as depression. More than 13 of Americans are depressed throughout their whole life. An estimate 18 million Americans experience major depression each year. 5 to 9 are women compared to 1/3 of men. Children ages 12 to 16 are also at risk for depression. Now that I have covered people who are highly at risk, let's talk about the medication and treatment for depression. People who are depressed may be unable to sense or admit their depression, which is the first step of getting help. Depression is a treatable illness with many therapeutic options available. Recognizing depression is the first step. There are 3 treatments for depression. 2 most important and widespread by are psychological as well as psychotropic medication, also known as antidepressants. Supportive counseling also can help depressed people. They help ease the pain of depression and addresses the feelings of hopelessness that accompany depression. Cognitive therapy changes the pessimistic ideas, the unrealistic expectations, and overly critical self-evaluation that creates expression and sustains it. Cognitive therapy helps the depression person recognize which life problems are critical and which are minor. Nearly 80 of those who are depressed can make significant improvements in their mood and life adjustments. Most people will experience some relief with 6 to 10 sessions, and approximately 7 to 80% of those treated notice significant improvements with 20 to 30 sessions. Now, let's summarize all of the information we learned today about depression. We went over a lot about depression. First, we learned the causes as well as symptoms. Second, we learned who is highly at risk. And last, we learned the treatment and medication to help cure depression. I hope all of this information was useful to you, and maybe it can help you prevent depression from occurring to you or anyone you love.